is Identity at the Center.
Welcome to the Identity at the Center podcast. I'm Jeff, and that's Jim. Hey, Jim.
Hey, Jeff, how are you?
Oh, not so bad. Yourself?
Doing great. Hey, did you know that we are the official podcast of ID Pro?
Yeah, I did know that. That was news we made back in, May, which feels like 7 years ago. But yes, very cool. idpro.org. You know, you and I have been fans of the organization, members of the organization for several years. And yeah, couldn't be happier about that.
Yeah, two things I wanted to point out. One is I'm sure we have a lot of listeners who are new to the identity space, maybe not ID Pro members yet. I'm not here to push membership or anything, but one thing that they have out there for free for the entire world to enjoy is the body of knowledge. I think the easiest way to get there is just go to Google, type in ID Pro, one word, and BOK for body of knowledge. It'll be the first thing that gets linked out to you. Click on that, and my goodness, it's just a bunch of educational material that you can kind of dive into for absolutely free. Now, if you are a member, the second thing that I wanted to talk about is the Slack channel, right? I mean, we talk about the Slack channel all the time, but it's just such a great resource where you can just go out there and there's a gig section, so you can put in if you have a job and you're looking for somebody and you want some help kind of recruiting people, or vice versa, if you're looking for a job, kind of putting that out there on the Slack channel. But there's all kinds of obviously identity content as well, where you can post questions or just be a lurker and read what's being written about topic, what kind of issues people are running into, and the people are happy to give on the ID Pro Slack channel.
So I agree with almost everything you just said. The only thing I'll disagree with is, heck yeah, we want people to go over there and register and become members. So yes, please, consider it. I think it's a relative bargain. I think it's like $150 a year for an individual membership, and the Slack channel alone is worth it. You can ask any question you want. There's tons of really smart, helpful people and people really to help. So everything you said, absolutely true. idpro.org. There's links on our homepage. I think I even set up a little flyout banner that says, official podcast for them. But yeah, super cool. We've done some episodes with folks. We had Joni on recently, and we try to do a quarterly update as well, just kind of what's going on with ID Pro at large.
Yeah, there's always a lot going on, and in addition, the additional benefit of having people on from ID Pro to give the update is they're great guests overall. So there are people who are deep in the identity space, usually with a lot of experience, and they make great guests for the podcast.
Yeah, they're actually real people doing real IAM things, not just
a podcast.
Yeah, exactly. So it's, even, Heather is is the director of it. And so she's doing identity stuff, and she's doing a whole bunch of writing, and she's got her own podcast thing, which is very cool. You should go check out as well. But it's actually real world identity people. It's not just vendors pushing product, which I don't think there's actually any of that I've ever seen. I think it's probably kind of a hard and fast rule is don't promote product, just get to the heart of matters. Kind of like this podcast, actually.
It's just kind of cool. So yeah, I mean, we see almost all the ID Pro leadership at all the conferences, and we're doing a bunch of conferences.
Yeah, been a busy boy. I thought it was going to be over when I got back from Vegas after Identiverse, but I've been doing some more Cyber Risk Alliance events. I was in Raleigh a few weeks ago, did a cybersecurity summit there. Moderating a panel on incident response. I'm going to be doing the same panel moderation in Chicago and in Philadelphia in September. So I've got free tickets for that if people are interested in coming out and seeing me. Hopefully I'll be able to get a good crew from the Chicago area, which is where I'm from, to kind of come out and support. But they'll be on our website, idacpodcast.com. Just scroll down a little bit. All of our discount codes are there. So that's cool. The relationship with Cyber Risk Alliance continues into Identiverse in DC in November. So that'll be fun as well. So shout out to Shirley, who's helping make all that possible. And then I think maybe we'll be done at the end of the year with Gartner in Grapevine, Texas in December. So we'll have a new identity game show that will be, debuting later this year, probably as part of that. So looking forward to figuring out the details of how we want to run that. So if you're familiar with Identisquabble and the stuff that we did with the Authenticate conference a few years back on Identifeud, stuff like that, that's the kind of stuff that we're looking to bring to conference, have a little more fun, and we'll be a little more entertaining. Not that knowledge isn't good, but look, we like to have fun, and we think this is an interesting way to approach it too.
Yeah, both CRA and Gartner have been great partners for us. They've graciously involved us in their conferences. Obviously, what you said about CRA gives us more opportunity to get out to these regional events. I'm not going to be able to make all of them. It's just been a challenging year in terms of travel, but I'll be kind of more back in the game towards the end of the year. But it's just been a great partnership, great opportunity to get out there and meet people. I think we're always, if people spot us at any of these conferences, just come up, shake our hands, do a fist bump, whatever you're comfortable with. And we'd love to get to meet you and just have a conversation.
Yeah. I mean, that's it. We put on our golden podcast pants just like every other person, so that's how we roll.
One leg at a time.
Exactly.
But then we make podcasts.
That's right. We make hit podcasts, global podcasts. All right, let's pivot here to our main star, our main attraction. Speaking of real people doing real identity and real security things in the real world, I want to welcome to the show Shawna Hofer. She's the Chief Information Security Officer at St. Luke's Health System in Idaho. Welcome, Shawna.
Thank you. Thank you, Jim and Jeff. Appreciate you inviting me to be here with you today.
Well, this is a conversation that's been a long time coming. We first met up, I feel like it was probably a couple months ago. We was like, all right, let's get this on the books and we get things going. So I want to give a shout out to Matt Franco, who's the person who made the introduction, one of my coworkers here at RSM, but definitely want to get into this conversation because I don't think healthcare is a topic that we've really kind of hit too hard in our 360 plus episodes that we've done so far. We've had a couple conversations here and there, but this is an opportunity for us to have, real conversation with you. Before we get into that though, I kind of want to understand your journey, right? What's your origin story? How did you, get where you are today as a healthcare CISO? Kind of take us through your steps to get there. Because I think a lot of people see CISO as a destination of where they would like to take their information security career. And maybe there's some advice that you can share with that.
Sure. Yeah. I think like many CISOs today, most of us say we have a unique journey in becoming CISO. So I would say I'm probably one of those as well. My undergraduate degree is in accounting. I had no idea I would end up in cybersecurity. After my undergrad, I got an accounting information systems focus for my master's. And that is where I started to pull in more of the IT space. I started my career at Deloitte as an enterprise risk consultant at the time. Really nice name for basically being an IT auditor. While I was doing that work for them, St. Luke's was one of my clients. And I got a call from my clients here at St. Luke's asking me to apply for the identity and access management manager role. And I kindly said, no, thank you. And my husband pushed me to interview anyway. I did. I fell in love with the company. My boss is also very persuasive, who is still my boss all these years later. So I came into St. Luke's leading the identity and access management team. I would say at the time it was probably more really an access management team. If you think about kind of how we think about identity and access management today in a kind of more broadly scoped focus. I did that for a couple of years. And then I ended up taking on all of cybersecurity a couple of years later. So I've been leading cybersecurity at St. Luke's for about 9 years now.
That is such a cool story. So I think a lot of people in this space kind of look at, like, all right, I'm an IAM. How do I bridge that gap and go from like an IAM manager? I was an IAM manager as well, sort of, working for companies and stuff like that before I got into consulting. But I think this is a turning point maybe for the IAM industry. Is it used to be that CISOs were like firewall and network security type people, right? And IAM was kind of just kind of an afterthought. But I'm kind of hoping, and hopefully you'll agree, is like IAM can also lead to a CISO type role within an organization. Obviously, case in point. Have you noticed any difference when it comes to like people with identity backgrounds and kind of their aspirations to maybe, have a broader cybersecurity impact, maybe as a CISO or other parts of a cybersecurity organization?
Yeah, I think people, but even just the industry in general, I think the perception around identity and access management, and I know for me, but I think for others too, it's very different than what it used to be. And when I think about the role that I led, and I referenced it being very much an access management focus, that's just not the only focus for identity anymore. And while yes, it was still a concept within cybersecurity, the risk associated with it is so much higher now. So I think when you think about a cybersecurity program and how to lead that, you can't do it today without having a strong knowledge and understanding of identity and access management as a whole. So yeah, I think it's changing significantly.
So now that you're the CISO here at St. Luke's, tell me about where you see identity security and why is it so important for healthcare? And maybe you can give me something that's kind of like beyond the obvious, right? Of course, patient data, health data, stuff like that. But maybe you can talk to me about the conversations that have evolved over time, as you've had this role, and where did identity start and what are the conversations you're now having with your peers and counterparts there?
Yeah, I think, part of that, and maybe it is part of the obvious, but worth highlighting, in my opinion, is the why. The why is different now. The why used to be very much patient data, cost of a data breach, cost of medical records. Example, we used to provide education to individuals around, hey, we really need you to be careful of that phishing email because we could get fined by HIPAA if we had a breach or what have you. And the conversation today is patient lives are at stake, and any one of us could have an impact on our ability to provide safe, efficient, and effective care to the people in our communities, by the way, which is us and our families and the people who live here. And so it's so much more meaningful to people today when you're having a conversation around the role that they play in helping keep a health system safe. And really what you'll hear people say is cyber safety is patient safety. Now you're hearing that in the healthcare industry more and more. And when you help them understand that from an identity perspective, it's that them as individuals and the things that they do day in and day out certainly have a role to play in that shared responsibility. So the conversation's different. It's far more interesting. They're more engaged. They feel responsible. And it makes that conversation and doing the right things or making the decisions about risk balance truly a more balanced conversation rather than, security trying to push security for security purposes.
Yeah, Shawna, I think that whole point of view really puts a finer point on the importance of what you do. And what I thought was really cool about that was, it really puts the context around how impactful it is when you make security decisions. So kind of the direction I was thinking of asking this question was around, traditional, I think regardless of the industry, the balance has always been user experience versus security. There's a trade-off, right? You give up one to get the other. And I think across the board, people are, sick and tired of that trade-off, but there is some truth to it still. I think the user experience in healthcare probably has a lot to do around speed, the speed of transactions. So thinking of the patient room and the ability to go in and use computing resources and not be slowed down by security. At the same time, you have the balancing factor that if things aren't secure, problems can happen. So you have this balance, but the patient's life is at stake. So how does that impact what you guys do?
Significantly. It's constantly a conversation of trying to balance experience and risk. But the balance, I would say, over time has also shifted. I recall when we started conversations many years ago around, hey, we need to implement multi-factor authentication. And at the time, the message you would hear from the physicians, regardless of whether it was cyber or IT, right? Around then was the time that we were implementing electronic health records, and many of them were having to move to a more electronic workflow. And so the message that you always heard from them were the number of clicks they had in their day, right? That the number of clicks was a measure for them. And so it was a mindset of we can't just add clicks. And that tone and that concern has changed to the point now where I think I almost have an ingrained assumption that we can't add clicks. And yet I have physician leaders who will say to me, we don't care. Like if it's more secure, we're going to do that. Right. And so it's really helped have those champions to say the risk tolerance of a few extra clicks or one extra click or a few extra seconds is worth it for us, and the rest will follow. And that's really been part of it. And I've found I have in my identity and access management team just ingrained in them, and I didn't need to do it. They already had it there, that customer service centric design, right? And so they're already very concerned about delivering that, to the point where sometimes I think we're more risk averse from a security perspective, even than our physician leaders would be. So for us, it's I think having the right leadership, non-cybersecurity leadership, our physician representatives, our nursing representatives at the table, to help us lean into that kind of risk tolerance and risk decision making, to make sure we're making the right call overall.
No, and I'm glad you used the term risk averse, because that was the term I was going to use. But I guess traditionally I've been wired to think more security equals more risk aversion, or vice versa. However you want to look at it, they're equal sides of the equation. If I make you log in twice, or I make you reset your password every 30 days, that is more risk averse. But could you imagine a scenario where you're providing patient care and you're in a critical situation? You need to see what medications this person's on, and they're saying your password is expired. You've got to go through a password reset. And it kind of seems like a ridiculous example, but I've got to imagine that, like, if you're going to change a setting that is going to potentially make that impact, you really have to do it consciously. You can't just say, all right, well, we're just going to push out updates every 14 days and not care like what the impact is going to be to our care providers.
Absolutely. And we have to ingrain that in every decision that we make, from a patching timing to responding to a cybersecurity incident. And we have this computer, we think it needs to be quarantined right away. Pause. Let's make sure that computer isn't tied to someone having surgery right now. And before we make those kinds of decisions. So we have to embed that everywhere. And what's really the trade-off in that is there's risk to both sides, as you pointed out, Jim. There are patient safety risks on the other side, potentially, of the cyber risk decisions. And so it really truly has to be an intentional balance. And that's not something that just the cyber team alone can make those decisions in a vacuum.
One thing, a topic that's real hot in identity today is this non-human identity, machine identity concept. And it's really, a lot of it ties back to the identity of things. It seems like things are becoming more connected all the time. And I know in your space, things are ever presently becoming more and more connected, which the advantages are obvious, but the security challenges are now multiplied, right? Because now you have attackers have more ways to attack those systems. And I mean, I'd like to hear your input on that, but I would think a lot of those attacks are based on identity and credentials getting stolen. And that's something that constantly you're thinking about.
Absolutely. The Internet of Things topic is a significant challenge for all of us, but in healthcare in particular, we have a lot of legacy technical debt, and that includes a lot of those IoT devices. We have things connected today that already blow my mind. I can't imagine the things that are going to be connected 5 years from now. Like we joke about, like pretty soon we'll have band-aids that are connected to the internet, right? Today it's things like treadmills and it's refrigerators that manage the temperature. It's camera. I mean, all the things already that you can imagine weren't necessarily built with security in mind, right? These are things that at the time we bought them, they came with a default password and a user manual that lives on the internet somewhere and wasn't top of mind to whoever brought it in to think about changing that password. And so those are things that security teams across the healthcare industry are having to grapple with now. And not to mention some of the medical devices that we bring in. These are $1 million devices, and they were built years ago, again, not with security in mind. And the manufacturers aren't really quick to get them up to date because the FDA process takes so long. And so we can't just replace them. So a lot of times you're not dealing with the opportunity to secure the device you have. It's how do you mitigate the risk associated with that device? Because you're keeping it for the next 10 years, right? So figure out a different way to come around those identity challenges, because this is just the reality that you're going to have to live with.
So let me bring up a question here. As a customer of those types of solutions, what kind of, rigor or imposition or request can you make to your vendors to say, look, this just isn't secure enough? Have something that's stronger than a 4-digit password on your thing, right? Like, what are some of the things that you can do as a CISO, right? And this is made for other people listening as well out there, is what kind of requests can you make to your vendors, and how do you help them understand, like, look, this is a great tool, but it doesn't meet our security requirements?
Yeah, I think the healthcare industry has really rallied to come around that so that each CISO isn't having to do it, though they do as well. So, right, just like any other industry, we've got our third-party intake where we're asking questions, setting expectations on design elements that are a lot better now than they used to be, right? So there's kind of a at least plug the hole concept here. But what's great about the healthcare industry, we have created a collaboration group called the Healthcare Sector Coordinating Council. It is a group made up of both public-private industry volunteers, which includes health systems like myself, pharmaceutical companies, medical device manufacturers, and representatives from the government to collaborate on how do we collectively raise the bar for healthcare cybersecurity. And it's through those relationships and that dialogue where medical device manufacturers and CISOs are having conversations about what are some other reasonable kind of guidelines that we're expecting in the design, contractual requirements that we can collectively hold each other to. I mean, these are conversations that as an industry we're having. And I think the more people who lean into the Healthcare Sector Coordinating Council will help continue to raise the bar, continue to push on maybe even some federal requirements that fall across all of those. And it has to be, I think, in my mind, at a level like that, rather than onesie choosy CISOs trying to move the needle. We need to do it together.
Yeah, you usually have like a coalition of folks to try and move things forward. I want to talk a little bit about AI, because I don't think we can escape any conversation about security at this point, or even an episode of this podcast without getting into AI at some point here. So let's get there. I guess with all of the AI things that have already arrived, what is the single biggest concern with how you can see that being exploited in a healthcare type environment? And please don't scare me too much, because I am frail and feeble and prone to frighten easily. But like, what are the things that you're already thinking about? It's like, oh my gosh, we got to get ahead of that. Or conversely, it's like, oh my gosh, that's going to help us out quite a bit. Because there's also a positive side of this as well, too, right?
There's so much positive opportunity in healthcare. I mean, the healthcare industry, we are significantly challenged with having the right amount of caregivers for our communities. There's not enough capacity to meet the needs. And so when you think about that funnel of caregivers is not also increasing to meet the need, the idea of AI is really exciting. And our health system, along with most health systems, is they're ready to rock, right? They're like, hey, AI is going to solve our availability, our access problems. And we need to lean into that. And I think when I turn that around and ask, okay, knowing that we need to help them meet that challenge, we need to enable the growth because it's the right thing for the organization and it's the right thing for our communities and the people who need access to care. It's my concern is, are we moving so fast that we don't know the risk that we're bringing in? Is my cyber team kind of upskilled to the level that they're asking the right questions? And then, of course, right, like that's just the enablement side of AI. How are we also still preparing ourselves to combat the threats of AI? And not to mention all of that in the healthcare industry, one with very small margins, which means not significantly increasing budget on the cyber side to meet the needs for all of those, but having to figure out how to come around it anyway. I'll give you some examples. So St. Luke's is, we have built an emerging tech lab here at St. Luke's with a partnership with CDW. And so we're bringing in kind of what is the art of the possible when it comes to future technologies. And some of the examples that we have, and the way that people can think about that is, how can we remove having a computer in the patient clinic room? Like, let's just take it out because it gives space. It allows for a better dialogue. There's not a computer in between the provider and their patient, which means you need to have more listening devices. We call them ambient listening devices, or we've looked at things like a digital whiteboard, for example. Well, bringing identity into that, how do you authenticate those devices with the person in the room or the person interacting with the whiteboard? Because I can't imagine them like typing a username and password. They need to be able to authenticate some other way. So trying to imagine how do we enable AI and also imagine how we change the way that we've done some traditional authentication pieces to be able to meet really that experience that we're trying to deliver in the future.
And this could probably give rise to new form factors for identity. You talked there about like the whiteboard, right? And I was like, all right, well, how the heck do I know who's writing on the whiteboard? And I was like, well, what if every doctor or nurse had their own pen that was assigned to them, and it's tracking what pen wrote on what device, right, or whatever it may be. I don't know if such a thing exists, but neither did tablets. Star Trek willed that into existence.
Yeah. But in healthcare, here's one of the challenges we also face from an identity perspective. And it used to be things like we would deal with doctors giving away their username and password to their nurses so that they could put in their orders for them. Today, we use things like badges, right? Where in the morning, you type in your username and password, and then you can use your badge throughout the rest of the day. And then we're dealing with badges floating. And Jeff, I love the idea of the pen. I can only imagine where those pens
just shot
end
all
up.
the holes in it. Yeah.
And so, I mean, you're right. We do have to imagine differently and also recognize the complexities of the environment in which they're in that are going to make some of that imagining a little bit challenging.
Shawna, I'm trying to make it better.
I love
but
it.
like these are the conversations like we have to have. I was like, all right, well, yeah, of course there's gonna be bad sharing. I mean, I used to work in the logistics part of IAM, shipping out those stupid RSA tokens, and that was a real nightmare. So, anything where a person has to have possession of something involves logistics. And that is just a real operational headache if you're not prepared for it. I want to go back to something you said earlier, and this was about upskilling around AI. And I think this is a question that I would like to get in more with you here is, look, everyone's talking about AI, and I think there's a genuine concern of AI is going to take people's jobs. How do people, especially in the security space, identity space that we're talking to here, right? What are the types of skills that they should be learning to try and stay ahead of that?
I think, and in my opinion, I hope what people can take away from that concern of I'm going to lose my job is I'm not going to lose having a job. I might lose what I do today, right? Like maybe I don't do those manual monotonous tasks that I've been doing day to day. Maybe I get to offload that and I really can do higher level work that I didn't ever have time to get to before. And I think if people can embrace that change, which can be very challenging, but if they can, I think the opportunity is there for people to grow in ways they probably couldn't imagine before. I think in the identity space, there's so much opportunity to dig into risky behaviors and things that are happening in the organization and people asking questions and doing things about that maybe that wasn't their role before. But if they had the capacity to do it and maybe the interest, I think there could be a lot more that we can accomplish if people will take that on.
I don't see it as any different as other kind of shifting technologies, right? The internet, everyone carrying a phone now has like all the information in the world. I mean, heck, YouTube has all the instruction manuals you could ever possibly want for anything and more being built all the time. The idea of I certainly think that there will be some disposition of kind of work, but when I've gone through this process, IGA, Identity Governance Administration, I remember deploying that, several years ago, decades ago now, because at this point, and there was a real fear, it's going to take my job, right? Because I'm used to creating Lotus Notes IDs and RACF accounts and Active Directory, right? And all this other stuff. But that's not what actually happened. What happened was exactly what you just said. My team went from being administrators to being analysts. And it was a different mindset, a different shift in how we approach the job. The people who were more interested in just kind of stamping out the next widget, definitely struggle with it more. But the people who were actually interested in learning more about security and the things that we're doing in IAM actually now had time instead of having to create the 80th Lotus Notes account that they had to do that day or a ticket that came in. So I definitely agree with that sentiment of like, okay, stay on top of it. I mean, just think about how much more efficient all of us are with even just the basic tools that are out now. And this is the worst it will ever be. It is continually getting better, scarily good. Almost every day there's some, some sort of improvement. It's like, oh my gosh, okay, now it can do that. Okay, let's figure it out.
That's right. But I think it really is a mindset, right? I think there are plenty of people today who have and are embracing that mindset. And then I think there's a subset who have to and will turn that corner. And then there might be some people who don't. And, of course, that's the group that I worry about the most. But the reality is if you can embrace it. And I think really it's better for you as well as the organization and really kind of all of us as a whole. I do think there's some caveats to that, though. I think that, one of my concerns from a CISO perspective is, we have to continue to be resilient. And in healthcare, that means we always assume as we're bringing in new technology and even just within our own network, we have to assume the worst will happen. And we need to be prepared for when that happens. And so we spend a lot of time talking about resiliency and investing in things like, well, what happens if we do have a major cyber attack and what's our downtime for that? And I want people to think about AI with the same resiliency mindset of how do we operate when it's not there, right? Making sure that people are maintaining that level of understanding and cognitive thinking capabilities so that in the event it isn't there for them at the moment they need it, like we can still get through the things that we need to do, albeit differently, slower, you name it. But the skills to do that are still important.
Okay. So I don't want to be the rain on the parade guy, but I think the positive message to people ought to be, well, you're right. AI could take your job. You better learn AI because there's some people who are going to still be needed. Here's the reality. It's like, Jeff, I know you are one of the biggest AI bulls I know. You just compared AI to IGA. When we get to super intelligent I mean, it's all bets are off. I mean, it's going to be able to do things that we can't even comprehend right now. So 5, 10 years down the road, like, you better really adopt AI and know how to get the job done with AI as it is today and keep up with it. We're entering a new phase of this kind of work that we do. People are still going to be required for some time to come, but I think like any kind of manual tasks or implementing software, writing software, I don't think that that's going to be a job 5, 10 years from now. I think it's going to implement itself.
Well, there's lots of jobs that'll change, right? I think we see like, development. We've been teaching and telling people for the last decade, hey, go to school and learn to code and you'll always have a job. Well, guess what? Now code is developing stuff and I'm building Python apps in my spare time on the weekends just to try out AI. I don't know the first thing about Python, but I've got functioning applications. So, there's that. There's just, so when I talked about the IGA shift, I just thought of it as that same mindset of, okay, it's automation. AI at the end of the day is a lot of it is automation. It's repetitive tasks. It's searching the internet. It's surfacing information, all stuff that a human can do. And I think, Shawna, to your point, what we can't have happen, and this is kind of a little bit of the idiocracy moment. It's like, well, it has ultralights. It's like, okay, well, we still have to know our content. We have to know our subjects. Yeah. We have to be able to still operate in the absence of AI, because I can't imagine an acceptable answer would be, hi, I'm here in the, the emergency room. And well, we were going to operate and save your life, but we can't because the computer's down, or the AIs isn't working. Like that's not going to be acceptable. So translate that to any number of, business applications, even just outside of healthcare. And there is still, room for humans to be part of this. But I think it does challenge us to stay on top of it because you always need to fact check it and things like that. I think that leads me to my hopefully, I think my final question for now on AI for you, Shawna, is at what point do you as a CISO trust AI to make decisions about your security infrastructure? Because I think this is an area that a lot of security vendors are going is they're saying, hey, guess what? Our firewall, our access management platform is now 100%, more AI. It's zero trust and blah, 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 right? All the buzz terms. But one of the things we're trying to do is really set it up in a way where the AI is making the decisions on the configurations of your security tools. So I'm going to ask you, as a CISO, when do you start to accept that is a reality and establish that trust that you are okay with that kind of thing?
Well, we don't trust our technology today. And we don't even trust today. We have incredible partners and we're very limited in what we'll let them do, mostly because we are in healthcare and lives are tied to those decisions. And so I think for us to get there, we would first of all have to have incredible data. Like the data needs to be spot on that would tell the AI agent, whatever is making decisions, the risk associated with those decisions. I don't think that today, I know for a fact, we don't have that data readily available. Today, it takes a human going and doing that digging in order for us to get there. So the when answer is, I can't give you a timeline, but I can tell you that I would have to put significant effort and investment into making sure that the data quality was good enough to even start the dialogue. So that for us would be a big part of that. And not to mention, I talk about the data, but it's the people. I mean, we are people who everyone who works in healthcare, or at least here at St. Luke's, we care. We care about the mission. We care about the people, which sometimes translates to, we don't trust you, and we don't trust you because, that's our lives on the line. And so I think there's a mindset shift too that would need to happen also with time, gaining trust and just using AI, right? Even before we allow it to make decisions. But hopefully, there's some progression to that. And are there some lower risk things we can start practicing with, really kind of understanding where can we start piloting it, accepting the outcomes, right? Where can we get to a point where humans maybe aren't always in the loop? Not on the healthcare side, of course, but really more on the cybersecurity side. I have to work on what those use cases might be. But in terms of those bigger decisions, the data just isn't there yet.
So, Shawna, one of the things that Jeff kicked off the whole conversation with was you starting out, or you being a manager of identity and access management. Now you're the CISO. One thing that I can tell in this dialogue that we've had over the past half hour was you, like other CISOs, talk about risk. You learn the language of risk, which I think translates what you do into business speak that the senior people understand. Like, here's the risk, cybersecurity risk, and how it affects the organization. This can't be a tough question. How did you learn that? What is your recommendation for upwardly mobile people in the identity access management arena to learn to speak the language of risk?
I learned the language of risk in accounting. I think when I joined the cybersecurity team, and certainly when I started leading the cybersecurity team, I looked at my background, my lack of technical background to be specific, as a complete downside to what I had to offer. And it took me years to realize it was actually my strength. It took me a long time to realize that ability I had to speak the business language was exactly what I needed to lead this team. And for those who don't have the opportunity, right, to start in accounting, because most today they start right in cyber, right? That's, I think, the difference in what we see in CISOs today versus maybe what we'll see in CISOs in the future is that many of them will start their careers in cyber. They knew it's where they wanted to be. It's where they'll grow up. I think there's so much benefit not always having a career in cyber. I think having experience in other places in the organization and other industries is significantly helpful to be able to speak business. Like, not only living in cyber, living outside of cyber, number one, like, advice of learning to speak business. But then beyond that, I think it has to be really an intentional effort. And for us in healthcare, it's going and experiencing what our caregivers are experiencing, right? It's putting ourselves in those shoes to make sure that you understand the challenges that they face, the decisions that we potentially are making that impact their workflows. You can't do that without being in their shoes. And it means going and being physically present with them to get that. So those would be some of the recommendations I would make, but they have to be intentional.
So I want to take that and kind of turn it into making the business case for identity. So a lot of folks who are listening, identity practitioners, are needing to make the business case. I always learned there are 3 ways to speak the language of business, making a business case. It was increase revenues, reduce costs, or manage or reduce risk. Usually cybersecurity leaves you only with that third option. Does that ring true to you, or how? What are the major factors when you're making a business case?
I think it depends on the industry. Like here in healthcare, the language that we speak in terms of risk, often, like, our number one always is patient safety, right? So to have a conversation and to speak business in a way that physicians, nurses understand, you need to communicate in the way in which matters to them. And for them, it's patient safety. if I'm talking to the CFO, certainly the CFO will talk in terms of revenue and cost, but that CFO has the same language mindset I do, that at the end of the day, we're a health system and we're here to keep people safe and keep them healthy. So it's that is a universal language to us. It's not just dollars. It's what matters to our core mission, which is taking care of people. So I think you have to understand that, right? You have to understand what is your industry, what matters. Dollars are universal across all of them and certainly is helpful. I don't know that risk is, I'll be honest with you. I think that there's a level of maturity that organizations have to be able to have conversations about risk and what that means at an enterprise level. You can try, but it doesn't always resonate. And so I think part of that is just having that understanding of your organization and the industry that you're in order to be able to facilitate those conversations.
So you're probably prioritizing different budgets and asks, right, for different security paraphernalia, we'll call it. Take me to the mind of your sort of internal throughout process, because everyone's fighting for money. And so how do you say, okay, well, here's the projects we're going to fund this year based on this budget we're expected to have. And of course, as soon as you put it down, right, things will change in the real world and you have to adjust. But that initial thought process of, okay, is this the year of MFA? We're going to get it done. Is this the year of PAM? Is this the year of, nope, we've got to shift some identity spend for projects to some other part of security? Talk to me about how you go through that sort of that mental gymnastic routine to try and juggle all that.
Yeah, I think for us, certainly we would take into account everything that we're aware of. To your point, Jeff, in this moment in time, knowing that will change, right? What are the findings we have? What are the threats that we're facing? And then really compare that with what's the value of the investment. I think is really important, because we can go buy a bunch of tools, or one, do I have the staff to fully implement and take advantage of that technology? And two, is it even going to move the needle as much as some of the work that might not require investment in new technology, but really just cleanup of existing technology, really like the non-sexy work, but maybe that moves the needle further. And in order to do that assessment, I think a big part of that is, what are the risks that we're facing? What are the attack vectors that we're seeing? And then what's our vulnerability to those within St. Luke's? And as you guys know, like, social engineering is one of the biggest threats overall. That is not healthcare is certainly a big part of that. And so it's asking ourselves the question, if one of the things we're going to continue to focus on is social engineering, is the biggest bang for our buck bringing in, MFA is already there. It's a non-negotiable, but bringing in better identity verification technology, or can we do better identity verification processes, right, for lower dollars? Or can we rely on education and awareness? So it's really being intentional about bringing the risk to an acceptable level for the investment, and knowing that decision might be good enough for now, and maybe you revisit in another quarter because the threat vector has changed, or maybe you need to make another decision around that. But for us, we have to balance all of those things. And here in healthcare, one of our strengths is that we have really caring people who find their way into the healthcare industry, which also means they're very vulnerable to things like, hey, can you help me? I'm a student and I would really love you to look at my resume. Or, hey, like those typical phishing type of things that just like tug on people's heartstrings. Like, healthcare people really, want to help and are hugely vulnerable. And so understanding what is the best way to combat that, and taking a look at, is it technology, is it process, or is it really just training the people, for example?
I love that answer. And I really like that you talked about non-technical things too, because you got things like, hygiene is what I'll call it, cleaning up your Active Directory, cleaning up things like that. And I'll disagree. I think anything to do with IAM is sexy. maybe not sexier than other things, but still sexy. Keeping a nice, tight, tidy Active Directory or, universal directory or, name your product, right? Whatever it is. That is all stuff that pays you back over time because it reduces license counts. It reduces risk for accounts, right, being compromised. If you ever decide to shift to some other product, now you've actually got a clean environment or cleaner environment than if you hadn't done that cleanup. So I think that is an often overlooked part of running an IAM program is hygiene. And so I'm really happy that you mentioned that. So kudos to you for that.
Yeah, but Jeff, keeping a tight Active Directory is not sexy. I'm sorry.
We just disagree.
Disagreement is great. But what we found, we brought in one of our interns recently to help us with some of this Active Directory hygiene, Jeff, that you would enjoy. But what we found, we assumed, right, this is just really like not fun work. He's out there trying to find owners for groups and whatever. He came in with the lens of, this is like investigation work and this is really cool. And he's having a great time with it. So you're right. I think it can be really interesting and really cool. At the end of the day, it moves the needle a ton, right? In that clean hygiene, it's a lot of work. But for us, it's been a really good source of investment of time and resources because we're not having to necessarily buy new technology, and yet we are significantly reducing risk.
Hey, what better way to meet the business and form relationships than try to find out, hey, Jim, do you know who this account belongs to? Is this yours? Right now you're out there, you're meeting people and you're the face of IAM. Who knows? You become the mayor of IAM town, whatever that looks like for your organization. I want to ask you one final question here, and this is kind of to close things out, is let's put on our prognosticator hat and say, okay, so what's coming up in the next 3 to 5 years? Is there an emerging challenge, some sort of technology or some sort of, business reality, especially, and want to hear about the healthcare side, is that you think is going to be very impactful? Is it AI or is it something else, or is it a combination of things that you're kind of thinking about? Oh, we gotta prepare for that.
Yeah, I think AI will be a big part of whatever that looks like. I think for us, it's a combination of how do you imagine delivering healthcare in ways we didn't before. For example, one of the things that we're looking at today is how do you deliver an inpatient or hospital-like level of care in somebody's home, right? And that helps us reduce the number of people in beds in our hospital. It helps reduce the cost of care, and ultimately there's better outcomes for patients in the data if they're at home rather than if they're in the hospital. And so, but today that's still pretty resource intensive, and nurses or MAs or others having to go to the patient's home. So imagine kind of really the future of that if you can embed the right type of technology into the patient's home and have kind of the virtual care options, monitoring that patient more closely or really helping kind of deliver that care. I think our ability to expand the capacity of care really is going to completely be limited on what we can imagine from a technology augmentation standpoint. AI will be a huge part of that. The devices, of course, will be a huge part of that. And then, as we mentioned earlier, the identity components and being able to enable that in a secure way, of course, is going to be huge as well. So for us, it'll always come back to how do we expand safely our capacity for care and provide a better physician experience, nurse experience, and ultimately patient experience. I think all of that is to come. I think it's really exciting to imagine. And I just want to make sure from a security perspective, we're there to enable it.
That sounds like a whole lot of identity management coming on with devices in the field and, non-human identities, machine identities, whatever you want to call those, plus the actual people part of it. I really appreciate you taking the time with us here. I do want to ask you one final super relevant question as we end here on a lighter note. If you were a potato, how would you be prepared?
I love this question. And You mentioned, Jeff, in your intro, I'm in Idaho, right? And everyone knows Idaho is known for Idaho potatoes. So I think this is a particularly relevant question for me. What I didn't share in my background is that I grew up, my grandparents have owned a family traditional diner for 50 years now. I grew up working in a diner. And the things that I think about in working there and craving the food from there are homemade French fries. My like fresh homemade with fry sauce. I don't know if you guys do fry sauce, but fry sauce is a big thing here. So if I were a potato, and I would want to be prepared in the form of homemade French fries, because I think about the feeling I have and wanting, just good like soul food or food that makes me feel connected with people and memories is homemade French fries.
See, now, Shawna, I knew I liked you. I knew we had a connection here because you mentioned, the food service background. I spent 10 years in food service. So everything from busing to serving, bartending, managing, even before, actually a little bit parallel before I moved into IT. But so I knew, I think everybody should have to be a server at some point.
Agreed.
and learn, how to interact with people. But that is such an interesting answer. So describe to me the home French fry. Is it a thick cut? Are we talking like tater tots? Like, help me understand here, the French fry experience that you're describing.
Yeah, I think it's not so thick that it's considered a steak fry, but it's not your really thin fast food French fries. It's greasy, right? Like they're chopping them. They store them in buckets all day in water, so that when you grab them, you drop them in the fryer, they come out like just covered in grease. And
so it's a health food.
It's so healthy, which is why it tastes so good, and can't have it all the time. But it's what the food I think brings back in terms of how it makes you feel and the memories. For me, that's where I land.
So we've asked this question a few different times, and my answer in the past has been potatoes au gratin, and I'll stay with that. Look, I don't discriminate. I'll eat pretty much any potato, as long as there's no sour cream on it. That's not my jam, but potatoes at large are good. Jim, how would you like to be prepared as a potato?
Okay, let me first start by saying I love mashed potatoes. I love baked potatoes. I love twice baked potatoes. I love fries. I would not want to have my skin peeled off and thrown in boiling water. I would not want to be shoved in an oven for an hour, and I would not want to be thrown in boiling grease. So I wouldn't like to be prepared in any of those ways. But I'd like to be is forgotten about in a dark closet. And I like to have those little green things growing out of me. And someone look at it and be like, oh, that's gross. I throw me in the compost pile and let me just sprout other potatoes.
Okay. So
can I ask you a question, Jim?
Yes.
I have a theory. When you were growing up, so Jeff, you already confessed you served in restaurants. You've already answered my question. Jeff, when you were growing up, or Jim, when you were growing up, did you work in restaurants, customer service, or did you mow lawns?
No, I worked my first job was at a gas station.
Gas station. So customer service facing. That's all right. Maybe you've had enough of that customer service. I have this theory that in IT, most of us either worked in the customer service industry, and those tend to be our more external or outgoing kind of folks. And all of the introverts did something like mowing lawns, and that's how you tell the difference. What did you do as a kid growing up? What was the job?
I think we might have to add that question into our repertoire. We always start all of our episodes with our first time guests as like, how did you get into this space? And time to time, we'll ask the potato question. So the potato question is interesting to me. And I promised you I would share this when I asked it. We were kind of prepping, and I didn't give you a whole lot of preface other than here's what I'm going to ask you. Just, be prepared. I've seen a bunch of different answers around this. The most common answer is how I would like to be prepared is what I enjoy the most from a deliciousness standpoint, right? It's It's the story behind it, is what I think tastes good, or the memories that you've got, right? That you kind of shared. The other part of that is the people who think of the pain associated with how that preparation is done. So Jim talked about, doesn't want to be cut up, doesn't want to go into an oven, right? Dropped into a deep fryer. And so he's not even thinking about the positive aspects or the joy that he could bring to somebody as a well-prepared potato. He's thinking about it, and he's not the only one, right? Mm-hmm. And I've asked this question so many times. This came up at Gartner last year as part of one of our sessions. Rebecca asked us that question. It's like, this is a question we ask. And so kind of got people thinking. What I've heard also is a little bit of a spin on Jim's answer, which he added the sprouting thing and throwing it into like a compost pile and making other potatoes. I asked my wife this, and she came up with, well, I'd want to be planted so I could be more potatoes. And so now there's like a third thing. Like, okay, well, I look like an idiot. Like, of course, you want to like be helpful for other people. But so there was the answer of, what do you like? The answer of, well, I don't want to be, killed essentially in this brutal fashion. And then a third answer, which is I'll call it the nurturing, life-giving, caregiving type of answer, where it's like, okay, yes, plant me and make me more potatoes. And I noticed Jim snuck that last part in there. That was not there originally, Jim, when I first asked you this, like maybe, I don't know, a year and a half or 2 years or however long it was, 3 years ago.
Yeah. Well, I didn't realize I was on the psychology chair. You're right. My main goal is not to be thrown in boiling oil or in a 500-degree oven. You're right. That is my main goal.
And I can't fault that.
People feel so good, right? Like
that's not my role on the show, Shawna.
Feelings.
My role on the show is to bring a dose of reality. At least that's what I see today.
All right. Well, Shawna, I hope to meet up in person at some point, and we can. We didn't even get to the fry sauce. The only fry sauce that I'm aware of would be like ketchup, and mayo is big in Europe. I definitely don't subscribe to that idea, but I would like to understand more about the whole fry sauce concept at some point.
Those things brought together, fry sauce and mayonnaise mixed together, makes fry sauce.
I'll try anything once. That's about as far as I'll go.
All right. I want to hear what you think.
All right. We'll go ahead and wrap it up this week for everyone here. I'll have a link to your LinkedIn profile in our show notes. So if people have questions about healthcare, IAM, security, fry sauce suggestions, I would say please don't send her resumes to review, because she probably won't click on that link, as she shouldn't. But I'll have that in our show notes. And then, so for us, make sure that you like, subscribe. We're on the web, idacpodcast.com. Don't forget all of our discount codes are on that homepage there. We'll make it real easy for people. And appreciate everyone watching and or listening. And we'll talk with you all in the next one.
You've been listening to Identity at the Center. We hope you've enjoyed the show. Make sure to like, rate, and review. And we'll be back soon. But in the meantime, hit the website at identityatthecenter.com. See you next time on Identity at the Center.